The ideas, procedures, and suggestions contained within this podcast are not intended as a substitute for consulting with a medical professional. All matters regarding your health and fitness require medical consultation and supervision. Welcome to the Warrior Wellness Podcast, a podcast for military members, veterans, and first responders focusing on fitness, health, nutrition, and biohacking. Our mission with this podcast is to introduce America's heroes to lifestyle habits and hacks that will help them live healthier, happier lives, and in turn, be fit enough to continue their support of their communities and country.
Hey guys, thanks so much for joining us on another episode of the Warrior Wellness Podcast. I'm your host, Stephanie Lincoln. I'm a former Army captain and founder of Fire Team Whiskey Military Fitness, and also your podcast host for the Warrior Wellness Podcast. So what we do each week is we kind of introduce you to some fitness, health, wellness concepts, all focused on biohacking, natural health, functional fitness, all the things that have nothing to do with drugs and surgeries and medications. So this is one of the things that we're going to be talking about today. I love this stuff. I can't wait to geek out with Dr. Tracy Gappen. He's a urologist and he is the founder of GainsWave. GainsWave is the premium brand of extracorporeal shockwave therapy for ED. So erectile dysfunction is what we're talking about today, performed by their network of highly trained medical providers. The treatment is an all-natural, clinically proven, using high-frequency shock waves to enhance male sexual function, performance, and overall health. It is not only a non-invasive procedure that treats the root cause of erectile dysfunction in men, but it increases blood flow and can be used for people who don't have erectile dysfunction, increasing blood flow, releasing growth factors in the tissue, forming new blood vessels, and breaking down microplaques in the penis. So we'll be talking to Dr. Gappen today about the prevalence of erectile dysfunction in men, the primary causes, and the natural treatments for people who can use to address this issue. And I was fascinated because I was doing some research about GainsWave, and fascinated to see that all sorts of biohackers out there, from Dave Asprey to Ben Greenfield to my carnivore fellow bodybuilding battle buddy, uses it as well. So this is actually something that men can use for natural sexual enhancement. You don't have to suffer from ED. So I can't wait to talk to Dr. Gappen about this. So even if you don't suffer from ED, this is still some good information for you. And those of you out there, ladies, this might just be some interesting information. Maybe you forward this podcast episode to your partner and, give them a little hint about maybe some natural ways that they can enhance their erectile issues, or just, get healthier in the bedroom. So we all want that, right? So I hope you enjoy this episode with Dr. Tracy Gappen, who is the founder of GainsWave.
Introducing the new Fire Team Whiskey Fitness and Nutrition app. Everything you need to get fit and lose weight right at your fingertips. Choose from hundreds of fitness videos and fitness plans. Search for workouts by fitness level, equipment available, or body part focus. Choose from several nutrition plans and customize your macros. Your entire fitness, nutrition, and wellness plan all scheduled on your calendar. Text a trainer anytime for tips, tricks, and motivation. Achieve your fitness and health goals with the Fire Team Whiskey app. Go to www.fireteamwhiskey.com to get 2 weeks of results for free.
Well, Dr. Tracy Gappen, thank you so much for being on the Warrior Wellness Podcast. And I already did your intro, so just wanted to dive right in here. So tell us a little bit about your background and what inspired you to develop GainsWave.
Oh, you got it. Thanks so much for having me here today. I appreciate it. So I'm a board certified urologist, men's health expert, founder of the Gappen Institute for Men's Health. And I've been in the men's health space now for 20 plus years, since I was back in medical training. And I've worked with men, both young and old. I have found that I really love working with high-performing men, men who are executives, men who are athletes, men who are military, men who are C-suite kind of guys. And I find the same sort of thing over and over again. And that is that, number one, men don't like to talk about their health. They don't like to pursue help for their health until it gets to a critical point where they're starting to have trouble. And that's when they finally decide to reach out for help. And it normally tends to be around sexual health. And I talk a lot about this men's health pandemic that we're experiencing that no one's talking about for some reason, where testosterone levels are plummeting and obesity is rising and cardiovascular disease is worsening. And we're actually experiencing a decline in lifespan for the first time in a long time. And for men, all of these health issues, vascular disease and insulin resistance and obesity and hormone disruption, all that affects sexual health. And so for me, helping, my passion, my mission is to help men be the husbands, fathers, and leaders that they're meant to be. And that's intricately associated with their sexual health.
Mm-hmm. Yeah.
Because if they're not confident, if they're not feeling at their peak, if they're not having the energy to get through the day and the vitality, then they're not going to be able to be there at work, at home, or anywhere else.
Yeah, absolutely. And it's kind of a silent suffering, as you said, and especially, our audience mainly is men and military and first responders. So,
right.
I've been in the military medical field for 15 years now. And it's just dominant. It is a silent suffering, and they usually, wait until something catastrophic happens to finally get help. So, we hope today's conversation will encourage people to maybe break their silence, and that there are some very well-documented treatments, natural treatments for ED. And I can't wait to talk about this a little later on in the podcast, that it's not just for people who suffer from ED. So, we'll talk about that here in a few minutes, but I'm interested to know what is the prevalence of erectile dysfunction?
Yeah, great question. It's probably a lot more than what's quoted out there. They say that by the time you reach 60, that over 40% of men have ED or sexual dysfunction. But I'll tell you, Stephanie, it's a lot more than that. And the reason for that is most guys don't want to admit it. Number one, they may not even be aware of it, or it may just not be an issue because of other issues, social issues that are keeping them from having regular sexual, encounters with their partner. So I would say that your age is probably the percent likelihood that there's an issue with sexual function in men like you. So a 60-year-old guy, 60% of men at least have some issues with sexual performance.
Yeah. And again, who knows, because people don't report. So we don't know,
exactly.
really what the actual numbers are.
Right.
But, what you do know is, just like with headaches, I've heard doctors say there's like 200 reasons why you might have a headache. So I'm sure it's almost as much as 200 reasons why you would have erectile dysfunction. But can you kind of narrow down maybe some of the few of the common causes of erectile dysfunction?
Absolutely. So number one would be vascular disease. And so when we think about an erection, if we back up a little bit and look at the actual physiology of what is an erection, it's nothing more than increased blood flow into the penis. And that increased blood flow causes engorgement of the venous sinuses of the penis. And that's what gives a man an erection. Now, when you have vascular disease, when you have poor blood flow coming in, that can cause a problem with erectile dysfunction. And so that's why when we hear, especially a younger man having issues with erectile dysfunction, we always recommend a cardiovascular workup just to be sure that there's not underlying vascular disease that may be at the root of it all. And so I always suggest for younger men to get that checkup done. But vascular disease is probably one of the more common ones. Men can have issues with nerve function. especially diabetics can get peripheral neuropathy. Anyone who's had pelvic surgery can have injury to the nerves in the pelvis that can cause issues with erectile function. A lot of guys have venous leak, which means blood flow may come in, but it rushes right back out as well. And so correcting that venous leak can be a problem also. A lot of guys can have hormone issues, specifically low testosterone can be one factor in sexual function issues. And then there's a lot of psychological stuff as well. The nerves that that stimulate that increased blood flow, they originate in the brain. And when there's psychological issues, when there's stress, when there's anxiety, when there's depression, when there's any kind of mood issue, any psychological things like that can cause problems with erectile dysfunction. A lot of guys will have this really unfortunate situation, this ugly, vicious cycle where they don't perform well once. Okay. And every man's going to have that. Every guy's going to have a situation where they don't perform like they're capable of. And that's okay. I want to reassure the listeners that that's a very common scenario, and that's okay. It doesn't mean there's anything necessarily wrong with you. But what happens is guys can't get out of their own way because now they're so worried about the fact that they didn't perform well that what do they think they're thinking about the next time it's time to perform? They're thinking about, damn, I didn't perform well last time. I got to get it right this time. And they're more worried about failing than they are about simply enjoying the moment. And so that stress and anxiety about performing can lead to difficulties performing, which further perpetuates this vicious, ugly cycle of not being able to perform when there may be nothing anatomically wrong at all.
Yeah, exactly. Yeah. And then, like you said, it becomes that vicious cycle of anticipation, anxiety, rather than maybe something physiologically wrong. Maybe it was just an off day, and everybody has an off day. So just like, exactly. I'm a big gym rat. You don't always perform 100% in the gym, right? I mean, you got off days. You can't you can't go back to the gym the next time and say, oh man, I had a bad day at the gym last time. Maybe I won't perform this time. I mean, you just have to kind of, push through it and go, man, I just had a bad day. So don't set yourself up for that anticipation.
Exactly right. That's right.
Hold on. The phone ringing in the background. Okay. Sorry about that. So I did want to dive a little bit more into, because, I'm huge into nutrition, and, and you've interviewed Danny Vega, and, I'm carnivore, and so is he. And we talk a lot about, body composition and just poor nutrition, and how this can kind of come into play. And what most men don't understand is that if you have a higher body fat, your body fat is actually kind of weirdly, and it's this strange thing that happens, it's gobbling up your testosterone. And so your testosterone can't do its job in the body because your body fat is basically eating it. So can you kind of describe a little bit more about, maybe some nutritional choices and higher body fat levels and body composition, how this can come into play with ED?
Absolutely. Thanks so much. I'm glad you decided to pivot into this topic because it's near and dear to me. And that is that when I talk about men's health and optimizing performance, I focus on what we call a systems-based approach to health. And what I mean by that is that there's not one single magic bullet that's going to fix erectile function. Yes, GainsWave is amazing for its ability to regenerate stem cell function and improve blood flow. But if you're not looking at all aspects of the system, then you're often going to be struggling to get the results that you want. And so when we look at things like, the causes of erectile dysfunction, one of them is low testosterone. And you're spot on. When a man is obese, when he has increased visceral fat especially, that fat has an enzyme called aromatase. And aromatase will convert testosterone into estradiol. And estradiol is not our enemy, but it is important that it's kept in a proper ratio of testosterone to estrogen. Mm-hmm. So many guys come in and they're obese and they have insulin resistance, which is basically either type 2 diabetes or early type 2 diabetes, where their body's no longer handling blood sugar the way it needs to. And they're obese. All this extra fat is turning testosterone to estrogen. So they have high estrogen and low testosterone. And the key thing to understand there is the estrogen is not the enemy. The estrogen is not causing the problem. It's the fact that your T is so low in relation to that estrogen, and all that fat, all that visceral fat is really crushing men's health. And so it's focusing on proper nutrition, proper sleep, stress mitigation, fitness, detox, hormones, all of the aspects of health that we need to optimize a guy's health so that we get sexual function working properly.
When you look good, you feel good. Guys, it's about time you threw away those stained t-shirts and those baggy, saggy shorts and upgrade your gym swagger. Zaya Active is the official workout wear of Fireteam Whiskey. Go to bit.ly/Zaya FTW and check out all the styles for women, men, and kids.
Yeah. And, I guess this kind of leads into the talk about, obviously you are, you're an MD, but you are obviously for natural treatments for erectile dysfunction and other things, obviously. So, but we are such a medical society, and we're so medically focused, and we have this medical, kind of focus in our society that, oh, if I just take the little blue pill or the little colored pill, so I won't pick on that one specific company, but it's about, oh, I'll just get the pill. And now, you can get it on the internet and, and I'll be good. And we're not focusing on, well, what caused it? We just jump right to medication. Okay, this will just, this will give me my erection that I want and I'll be good to go. But, and then it's almost like a kind of a case of denial. It's like, you don't want to know what led up to it. You just want it fixed, right? And you don't want to have to do the work. You just want to take the pill and have it magically happen again for you. So I love that you, as a doctor, developed a natural and clinically proven way to use a natural approach to help enhance male sexual function. And I'm sure that all the people in your network are not just, okay, well, just do this and you'll be good. They're talking to the patients about lifestyle choices and improving their health holistically, rather than just, this is just a medical treatment, quote unquote, and we're going to fix you, quote unquote, and you'll be good to go.
Yeah, you're spot on. So, the blue pill, the yellow pill, they're Band-Aids. They're basically short-term Band-Aids, and after a while, those Band-Aids don't even stick. They don't even stay on. They don't even work. They're ineffective. And so I talk a lot about the fact that this one-size-fits-all, Band-Aid approach to health is failing miserably. And so taking a comprehensive approach to men's health, focusing on all of the inputs to the human system and how they're ultimately affecting us. Look, sexual function is one piece of a much bigger picture. And when a guy is having issues with ED, that's not the problem. That's not the problem at all. He has issues with hormones, micronutrients, probably high stress, insulin resistance, obesity, toxins, mindset issues, all of these factors that affect a man's health. It's showing up as sexual dysfunction, but that's certainly not the cause, and that's not the only issue that a guy has.
Yeah, exactly. So it's the Band-Aid approach that we just have been taught to do in our lives. Like, you have a headache, take a Tylenol. You don't ever wonder about, well, what caused the headache? So
exactly.
Let's back up and look at and be open to, understanding that there may be several things in play, not just one. And we can kind of take care of these things, so you don't have to have this issue get worse, like you said, get worse and worse. And even the medications don't work anymore. Now what? So you're kind of at a dead end. So let's talk about GainsWave. And I'm sure that you get this question a lot, because when you're talking about penis and then you're talking about frequency shock waves in the same sentence, probably a lot of eyebrows go up. So let me have you explain how GainsWave works.
Yeah, so GainsWave, first of all, is painless. So I'll start with that for the listeners who may start to freak out when they hear the concept. It's a completely painless procedure. What it is basically it is stimulating new blood flow. Okay, that's the short answer of how does GainsWave work. So the technology is actually sound wave delivery through a probe. It is the same technology as we use when we're treating kidney stones. As a urologist, 20 plus years doing urology now, we've been doing lithotripsy or shockwave lithotripsy since I was in medical training. And that involves a patient laying, they used to be in the bathtub. Now they're laying on an operating room table. And we deliver sound waves through the body into the kidneys to break up and crush kidney stones so that they can then pass. Well, what we found is that if you take that technology at a very low intensity, it actually has pretty magnificent effect on stem cells. And what that does is that stimulates a process called angiogenesis. And angiogenesis, it simply means creating new blood vessels, excuse me. So when you stimulate angiogenesis through stem cell activation, you are reestablishing, you're regenerating, you're repairing the blood flow to the penis. And that's the concept behind GainsWave and why it's so effective, that we're no longer addressing this fairly substantial, significant men's health issue. We're actually addressing the underlying problem. Now, I'll also emphasize that I don't typically like to do GainsWave by itself, because we have to deal with the much bigger systemic issues that guys are dealing with as well. And so that's where I take, again, the comprehensive approach that we talked about. But I think they pair together nicely because we're now focused on fixing the underlying cause rather than having you come back every few months for another blue or yellow pill Band-Aid that doesn't work.
Yeah, exactly. And, I believe firmly, and I'm sure you do too, as kind of more of a natural focused doctor, it's all about inflammation, right? I mean, it's about getting the inflammation down as much as possible in your body. So your body knows what to do. It has the tools to heal itself. But if it's constantly inflamed because you're eating very poorly, you're sleeping poorly, you're highly stressed out, you've got a lot of extra body fat, you've got some chronic health conditions, you've got high blood pressure and pre-diabetes or diabetes, you've got all this inflammation going on 24/7, your body never has a chance to heal. So just putting a pill into your body and forcing it is not getting your body in a state where it can actually heal itself. So yeah, and that's what your device does. It kind of provides this time of healing, but if you're not working on the other stuff, it's going to be a continued problem.
Yeah, absolutely. You got to look at the big picture, and we have to stop taking this this very narrow-sighted view toward health as use a pill to fix the ill. And we need to start focusing on addressing the underlying problems. And that's what it's really all about.
Yeah. And I think probably the question you get most is, are you going to insert something into my penis? Like, how does it physically work? What's a typical visit like?
So I compare it to an ultrasound, a diagnostic ultrasound. So when you get an ultrasound, it's simply a probe that is placed on your skin with some gel, and it through sound wave echo is able to image the inside of your body. GainsWave is done with a similar type of probe. It looks like an ultrasound type of probe, and it's put on the penis, on the surface of the penis with some gel. And you hear these loud click, 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 click as it's delivering these sound waves. But again, you barely even feel anything at all. There's certainly no pain involved whatsoever.
Yeah. So what are kind of some reports of people who use the GainsWave? What's the difference between kind of a before and after?
Yeah. So what I find is most men, and certainly there's never a guarantee with any treatment, but I found most men who have GainsWave treatments will notice an improvement in their spontaneous erection. So that means that, a lot of guys who are using the blue or yellow pill, suddenly now they don't need it because they're able to get an erection on their own without that assistance. Or perhaps they're using, 5 of the little blue pills and now they only need 1. And the goal is to eventually get them off of it completely. So I find that a lot where guys are suddenly able to perform without the need for support. I find, this comes down to a change in a man's confidence. Mm-hmm. And to me, that's something that can't be overstated. When guys take sex seriously, okay? Guys think about sex every 6 seconds. Supposedly a guy thinks about sex. And sex is a big part of a man's life. And when he can't perform, it's debilitating. It's psychologically devastating for a guy if he can't be the man that he's used to being. And so to be able to change that aspect of his life to where he can now perform in bed, that affects his ability to perform at work. That affects his relationship with his kids. That's how a man's sex life is directly tied to other aspects of his life, because it affects his confidence and his sense of well-being. And so I think it's a critical part of men's health that really should be a focus for that reason.
Are you Fire Team ready? Try the Fire Team Whiskey Spec Ops Keto Joe Shake. The Keto Joe Shake is a medium-chain triglyceride MCT shake derived from non-GMO coconut oil. It contains 17 grams of MCT, 10 grams of high-quality whey protein, and no sugar. It's sweetened with stevia leaf, so you can keep those carbs low and shred that body fat. 25 milligrams of caffeine to give you extra energy for the gym or your busy day. Fire Team Whiskey has been supplying military members deployed all over the world with Spec Ops shakes for over 3 years. Fire Team Whiskey Spec Ops shakes are fueling the fight. Whether you are just trying to lose a few pounds or trying to get that extra edge in the gym, the Fire Team Whiskey Spec Ops shakes are for you. Make sure to stock up now and support our efforts to raise funds for Team RWB, our nonprofit partner that provides social support and fitness events for our nation's heroes.
Yeah, absolutely. I love that. And so let's talk about the people who maybe don't suffer from erectile dysfunction. I saw one of my favorite biohackers, Ben Greenfield. He uses GainsWave, and he said he is a, quote, definite customer for life, unquote. So that's fantastic.
He's a firm believer.
Yes, all the puns. And my fellow carnivore battle buddy, bodybuilding buddy, Danny Vega, he uses GainsWave, and he did a whole live showing his procedure. So, so GainsWave can be used for people who don't suffer from erectile dysfunction. So can you talk about the benefits of somebody who maybe doesn't suffer from this, but what they can gain from using it?
So I love using it just for sexual enhancement, or really improvement of sexual performance for a guy that doesn't have any specific trouble, just wants to make it better. A lot of guys, they function okay, but they just want to boost. They want to enhance it or improve it. And that's where there's really beauty there in being able to offer that option of improving the blood flow, preventing issues before they develop. And now there's actually a handheld device that I offer to men as well that they can do in the comfort and privacy of their own home to add to those benefits that we get with GainsWave by being able to do treatment enhancements themselves at home in between sessions in the office as well.
Oh, wow. That's huge. That's great. Yeah. So, and to back up on, the comparison of the medical treatments versus natural treatments, obviously this is safe. This isn't something that you got to be concerned about side effects, like the long list that you hear on the little blue pill, the commercials you see on TV during the Super Bowl. It's like they spent 30 seconds on all the side effects. So, this is completely safe for anyone to use.
Absolutely.
Yeah, great. Well, thank you so much, Dr. Gaffin. This has been a really fascinating conversation, and all the links to the GainsWave website and all your social media will be on the show notes.
Wonderful. Well, thank you so much for having me. Enjoyed it.
Yeah, thank you.
Hey guys, thanks so much again for joining us on another episode of the Warrior Wellness Podcast. Please make sure to subscribe, follow, like, all that good stuff on your favorite podcast platform and on our YouTube channel. Go ahead and leave us a review while you're there. And if you screenshot your review, email it to info@fireteamwhiskey.com with your name and address. You'll be entered into our drawing for a prize for just leaving us a review. So let us know what we're doing great, what you'd like to hear more about, and please go ahead and just give us a follow and give us a honest review, especially on iTunes, because that helps us reach other military members, veterans, and first responders with this vitally important information about how to improve their health, fitness, and wellness. We will see you at the next episode of the Warrior Wellness Podcast. I am your podcast host, former Army Captain Stephanie Lincoln, founder of Fire Team Whiskey. Fire Team Whiskey is proud to sell Zaya athletic wear. We love the awesome styles, amazing quick dry technology, and best of all, the price. Zaya Active is the official workout wear of Fire Team Whiskey. Go to bit.ly/Zaya FTW and check out all the styles for women, men, and kids.